I think it's not fair. More than 7 million people in the world, people who cannot see, cannot hear, and cannot speak. But we found a solution. My team has created a device and software with the help deafblind people to communicate, get education, and choose new professions. And we would like to find partners and impact investors who help in socialization of deafblind people.
We face a global epidemic of dementia. Screening tools used by doctors have limitations. In Accessible, we have built a platform to early detect and monitor dementia through speech analysis, with an accuracy of more than 92%. Our solution can be used remotely. It's non-intrusive. It's available in English and in Spanish, and it reduces the time to diagnose. In Mass Challenge, we are looking for partners to early detect and monitor dementia through speech analysis.
Hi, I'm Digbi Health, the CEO of AEYE Health. We prevent blindness by increasing accessibility of retinal screening to more than 80 million Americans who are at high risk for blindness due to diabetic retinopathy, glaucoma, and AMD. Our artificial intelligence solution works on portable retinal cameras and empowers PCPs, endocrinologists, and pharmacies to screen their patients without a referral to the ophthalmologist. Founded in 2018, we have major collaborations and are expecting FDA clearance. We're looking for US partners that can help us scale.
About 80% of healthcare data is textual, making it impossible to automate time-consuming tasks. At Agamon, we specialize in NLP, converting those unstructured clinical data into structured data in order to streamline administrative processes, improve quality of care, and increase revenues. We started with radiology, and we are open to expand to other areas, where our platform can extract useful information and solve your challenges. Thank you.
Hello, my name is Nirav Shah, the founder of Alertive Healthcare, where we aim to make remote care within reach. We support enterprise healthcare systems by onboarding, identifying patients, remotely enrolling with real-time software for communication and decision-making, as well as billing support and revenue cycle management at the end of every month for Medicare and commercial plans. We have over 32 customers with 5,000 plus patients monitored, robust clinical outcomes data, supported by over 100 insurance plans across the US. Thank you. We look forward to working with you.
I'm Dr. Ellen Half-Davis, the founder and the CEO of Aparito. After 18 years of supporting patients through clinical trials, I decided to design a platform that was patient-centric to support them through the process. We now co-create to deliver a solution that works for patients, sponsors, and regulators as we achieve digital therapeutics and meaningful care. Thank you.
At Augment Therapy, we're using technology to motivate kids to do therapeutic exercise. Kids feel like they're playing a video game, but our evidence-based exercises and objective data collection are a therapist's best friend. Best of all, our augmented reality solution doesn't use any wearables and can be used in the clinic via telehealth or for remote patient monitoring for ages 3 to 103. We take the pain out of therapy for patient and provider.
Hey, I'm Robert Alexander. I'm the CEO and co-founder of AuraLab. We're a team of avid meditators and technologists who believe that the field of wellness technology is long overdue for a paradigm shift. Our mobile app Breathscape is using patent-pending technology to create content that's personalized in real time for each user in every moment based on their breath. We're currently collaborating with the research team at UCSF to get a better understanding of how our tech is improving health. And now we're ready to step in and engage with a corporate partner to design the future of benefits programs. Thank you.
BetterYou is a digital coach that helps you make more time for your health. We've helped populations get an extra 30 minutes of nightly sleep, find an extra 10 minutes per day to talk with your friends and family members, and improve physical fitness and exercise. Today we work with over 55 enterprises, including Aligna Health, Michigan State, to help people find more time for those things that really matter. It's our job to help you get one step closer to a better you.
This is Jonathan Fite at Beyond Lucid Technologies, and we're proud to be a technology partner to fire and EMS agencies in the state of Massachusetts today, helping to connect them with hospitals, health information exchange, and other parts of their public health ecosystem. We ensure that information about the patient, such as whether they have a substance use disorder, chronic disease, whether they're in acute crisis and have an end-of-life document, such as a MOLST form, that information is available to the healthcare ecosystem at the patient's side and shareable in real time.
Today, patients want medical care without going to the doctor. This requires medical devices that patients can use on their own. But enabling medical devices for remote use is difficult and takes years. Data regulations is one reason. Making the usage of the remote device compelling to both the patient and the doctor is a second reason. Our AI-powered cloud product enables device companies to implement remote use in just 4 months. Heart implants and more FDA-cleared devices already use bioT today.
With total U.S. expenditure on mental health reaching a predicted $238 billion by the end of this year, Butterfly Health is poised to disrupt the behavioral health market by focusing on the massive and expanding Medicaid population rather than fitness and wellness buffs. We are responding to the urgency of now and filling a critical void for health systems and managed healthcare plans to provide culturally competent, cost-saving care to vulnerable populations.
As a caregiver for a cancer patient, I've seen how health hardship diminishes the rest of life. Its necessities become burdens and its joys fade away. Friends and family want to help out, but they often don't know how. Caregather's research-backed social support software brightens the life around health by gathering friends and family together. We then guide them to provide support that improves quality of life and reduces caregiver burnout. We're looking for a champion focused on whole patient care who will help us introduce the power of social support to patients and caregivers when they need it most.
CareStarter is a unique company. In fact, we're the world's first fully automated care management platform. Our mission is simple: to help our partners like the Air Force to reach 100% of their patient population with individualized resources that are customized by age, diagnosis, and where they live. Together, we will impact patients as people and learn from our robust data network key insights that will help us bring health equity to all.
Hello, I'm Urte, and my team is developing a cutting-edge Class 1 telemedicine device called FeetC, indicating early signs of inflammation over the soles of the feet. FeetC enables people with diabetes to easily monitor their feet at home and indicates when the person at home and healthcare provider should communicate for further evaluation to prevent diabetic foot ulcers. It's a HIPAA-compliant device currently undergoing a clinical trial with 112 patients and will receive FDA clearance in 2021.
Digbi Health is the first digital care company that has successfully integrated gut microbiome, genetic, blood, and lifestyle-based risk signals to deliver programs for inflammatory, digestive, skin, musculoskeletal, or insulin comorbidities typically associated with obesity. Our programs are offered as a fully covered benefit by leading insurance payers and employers.
Everyone deserves a fresh, tasty dinner, but the social determinants of health, like food access, affordability, and cooking know-how, foster food inequity and fuel the progression of chronic disease. EatWell is looking to partner with payers and hospitals to prescribe our nutritious meal kits to patients at a high risk for chronic disease, food security, or for COVID response. Our goals are to validate the impact our meal kits have on alleviating social determinants and improving health outcomes.
Hi, I'm Rashna. Ejenta is using AI and automation technology developed at NASA to monitor astronauts in space, and we allow health providers to remotely care for patients from their homes. We're working with leading healthcare providers across the US, like Kaiser Permanente, where we have shown dramatic improvements in outcomes for patients with heart failure, high-risk pregnancy, diabetes, and hypertension. And now we're expanding to renal disease, HIV, and most recently to monitoring both healthcare providers and patients for COVID-19. We'd love to talk to learn more about what use cases are most important to you. Thank you.
Hi, I'm Tammany Petrie, mom to 2 sons with disabilities, and I founded Everyday Heroes Kids to connect families to pediatric professionals and organizations in one simple search, because finding the right professional at the right time can be life-changing for a child. And now more than ever, families need easier access to professionals, telehealth, resources, and transitioning care support. And we create a circle of care around the child that is easy to navigate and make informed decisions at a time it matters most.
Hi, I'm Jennifer Freed, co-founder and CEO of Explorer Surgical. Our software platform is a digital and remote case support tool for medtech companies to provide best-in-class support to healthcare providers in the OR and procedure suites. Physical distancing isn't possible in the OR, and our technology gives providers the product support they need without the safety compromises of crowding the room. Our HIPAA-compliant software is used on mobile devices and existing hardware. No large capital installation required.
Hello. Although millions of today's elders are aging in place, they sadly face social isolation and fall risks. As a trauma surgeon, I founded our company to create apps that enhance safety for independent lifestyles. Our first app, Elder Check Now, exchanges well-being information through check-ins. Our medical alert app, FallCall, brings voice-activated emergency monitoring to Apple Watch. Our future includes patented smart fall detection, AI for fall prediction, a well-being call service, and Bluetooth add-ons. Through insurance and enterprise integrations, lives can be saved. Thank you.
Your researchers and data scientists are doing fantastic things with AI in R and Python, but the problem is that your actual scientists and business users aren't programmers, so how do they access it? Well, we've been building for a full year with one of the largest healthcare companies in the world, a platform that allows your data scientists to upload what they've built into an internal marketplace, and your scientists and business users to download those and use those in a no-code, user-friendly interface. We want to collaborate with you on the next gen of this platform.
Healthy Health helps health and life insurers truly revolutionize their underwriting by allowing any prospective applicants to skip the need for filling out questionnaires and medical exams and instead share their digital data. That helps them to reduce sales cycles period down to 2 minutes, achieve a profitability rate of more than 87%, and reduce costs by more than 10 times. We are now live with some of the world's largest life and health insurers across the world with more than 500,000 users. So why don't you come and be our next user? Thank you.
Heartfelt Technologies solves repeat hospitalization for heart failure. Our medical device is based on AI cameras in the patient home, automatically detecting fluid accumulation and early warning of hospitalization. Diuretics then avert hospitalization, or worst case, an ER visit becomes an outpatient visit. The patient doesn't need to wear anything, do anything, or change behavior in any way, so it works for dementia, alcoholism, and everyone else as well. We're CE marked through FDA, used by the NHS, and want to work with you to bring this to America.
Highly engaging yet scalable digital therapeutics that make cognitive behavioral therapy universally accessible. Our evidence-based digital solutions have been tested in numerous clinical trials, proving that we are successful in empowering people to maintain and improve their mental health. In short, we help people to help themselves. We invite you to join us in reinventing mental health care so that more people get the care that they need and the care they deserve.
In America, being a person of color is bad for your health. That's why I started Hued.
HUED is a healthcare engagement solution tailored to address the needs of Black and Latinx populations. We provide multicultural patients with access to culturally competent healthcare providers, offer health literacy, and help organizations transition to value-based care. This solution reduces barriers that these communities face, and we look forward to working with you champions.
I'm Albert, the founder of Hypercare. 14% of pages go to the wrong doctor, and half of them were emergencies. Hypercare is solving the #1 cause of preventable death in healthcare, miscommunication. On a given day, clinicians are wasting an hour playing phone tag with their colleagues about their patient. Hypercare helps clinicians and support staff find the right provider, whether on call or by name, and communicate without barriers. We're looking for innovative organizations to work together and enhance how care is coordinated.
Hi, I am John, CEO and founder of Iterative Scopes. We are focused on AI applications for inflammatory bowel disease. The success of trials currently depend on our ability to determine the severity of inflammation in bowel like this, and in turn, lives that consume these drugs on a lifelong basis. We are using AI algorithms to automate this process and then creating clinical decision support tools to help bring this knowledge into clinical practice.
As the health system moves to more accountable care, the need to coordinate and navigate providers outside the four walls of the hospital becomes increasingly more critical. Complex problems in chronic disease management are exacerbated by social determinants of health, mental health issues, and substance use disorders. That's where Gelada comes in, bringing a network of community resources to the fingertips of the clinical practitioner while managing mental health, criminal justice, and HIPAA compliance in real time.
Alzheimer's is the most expensive disease in the US, costing an annual $290 billion in direct care and another $235 billion in value of unpaid family care. Not only could tens of billions be saved by reducing preventable hospitalizations and helping loved ones live at home longer, these savings result in better outcomes. Kinto is a technology-enabled care coaching service developed in partnership with the Alzheimer's Association and sold to payers and providers to train and support caregivers to deliver the best care while reducing costs for themselves and society.
Hello, I'm David Franklin, founder and CEO of KnowRx. KnowRx was formed shortly after my father passed away in October of 2018 due to a medication-induced side effect. I began to search where to help solve this problem, and it begins in clinical trials. KnowRx is a machine learning platform, Maestro ML, that powers the selection of patients for clinical trials that facilitates significant cost savings and efficiency gains within clinical trials. We look forward to speaking with you this week, and thank you for this opportunity.
At Lena, we solve the massive problem of social isolation in seniors. We match seniors with a real human virtual Lena companion combined with a text-based conversational AI to provide concierge support in navigating their complex care. We've seen 40% reductions in ER visits, 67% reductions in readmissions, and 44% reductions in loneliness scores from vulnerable populations like hospital discharges and low-income patients.
Hi, my name is Raphael Potter, and I'm presenting on behalf of LifeGnome. LifeGnome is the world's B2B genomics and AI precision health platform. We were founded in 2016 by 3 scientists, each of whom are among the top 25 most cited scholars in the world in their respective fields. To date, we have partnerships with institutions ranging from the World Economic Forum to Unilever to Deloitte, and we've won a variety of awards and recognition, and we hope that you will be our next partner. Thank you.
I'm Swati, founder and CEO of Lightsprite. We are transforming mental health because we believe it's a foundational pillar to overall health. Reach out if you are looking for solutions for remote monitoring and behavioral health integration. Talk to us if you want to reach patients of all ages and underserved communities in a fun and uplifting way to reduce loneliness and isolation. improve mental health and resilience, and address addiction. Games get people engaged. Engaged people get better faster.
Litmus is research-ready infrastructure for real-world data. We help pharma companies better understand patients' behavior and environment. We're data engineers that your data scientists will love. For Takeda and the University of Chicago, we're helping study sleep and activity to build a predictive model for flares in Crohn's and colitis patients. For Bristol Myers Squibb, we're looking at quality of life in lung cancer patients and establishing an enterprise-wide real-world data stack. If you're ready to leverage data collected from wearables, smartphones, or novel sensors, we'd love to speak further.
Hi, did you know the estimated cost impact of gene therapies in the US is $45 billion by 2024? Healthcare entities need new payment models and technology to ensure affordability and access to innovative therapies for patients. And that's exactly what we enable with our groundbreaking value and outcome-based contracting platform. We make it easy for you to systematically contract and pay for value and outcomes, enabling better health outcomes at lower cost. Already working with healthcare payers and pharmaceuticals around the world, we can do the same for you.
My name is Jan Sevchuk. I'm the co-founder and CEO of Medical Search Technologies. Medical Search Technologies has developed a predictive modeling platform which can ingest any type of unstructured text, including operative notes, physician notes, radiology, and anything else in the healthcare sector. Using that data, we can build models to automatically code operative notes, predict and route the type of service an application may require, and many other types of needs.
Hi, my name is Jane Newton-Small, and I'm CEO and founder of MemoryWell. MemoryWell grew out of my experience caregiving for my father, who had Alzheimer's. And a few years ago, when I moved him into a community, instead of filling out this enormous 20-page questionnaire, I wrote down his story. I was a Time magazine correspondent, and that's what came naturally to me. So now providers pay us to write these stories, not only to improve value-based care scores, but also for the mineable and searchable databases of social determinants of health that we collect.
At Mendelian, we find patients suffering from rare and underdiagnosed diseases. Our software scans electronic health records and is deployed in over 1 million patient records across the UK. Our research shows that with our software, a patient can be diagnosed up to 4 years earlier. Earlier diagnosis means earlier treatment and potentially better outcomes. We have a huge opportunity to impact patient lives, and we hope we can work together. Thank you.
I spent a decade monitoring black holes. It shocked me that when I was experiencing stress, there was no way to easily monitor my health with medical-grade accuracy. I used my skills to enable precision monitoring of our vital signs through two things we all use: earbuds and smartphones. Now, our Novi earbuds are in clinical trials providing unprecedented insights into our health. Our solution will allow monitoring your patients in the comfort of their homes. We invite your partnership to make that happen.
Hi, I'm Sarah Shuey, and I am the founder and CEO of Mosaic. Mosaic aggregates electronic medical record data to provide a more complete picture of a patient's care. My background is that I worked for many years at Epic, and I have an MBA from Harvard Business School. And last year, Mosaic won Harvard's New Venture Challenge. If your organization is struggling with data silos and wants to get more from your data, I would love to talk to you about how we might collaborate. Thank you, and I hope you are staying safe.
Behavior data collection and dissemination are critical challenges for monitoring and evaluation in education, healthcare, research, and many other fields. What if we could efficiently capture and communicate events as they occur and identify trends as they happen, rather than summarizing later? With everyone on the same page, we eliminate the time spent trying to describe what we saw and instead focus on finding solutions. MyTapTrack's comprehensive system does just that. Can you imagine what we could do?
I'm John Huggins, CEO and co-founder of Notable Systems. We capture any data, structured, unstructured, typewritten, even handwritten, from any document with unbeatable speed and accuracy. We take data from documents as diverse as medical records, insurance forms, or financial statements, validate the data against your business rules, then integrate that data into your workflows. Notable Systems, fast, accurate, intelligent data capture.
Now is the time to rebuild, and digital health will be the core of our rebuilt healthcare system. But while doing so, we cannot forget the trust and empathy that nurses and doctors bring to patient care. Nurse 11 and our network of over 1,500 providers can be embedded into your organization's digital health platforms to offer live text, phone, and video consults. Our providers will ensure that empathy and trust will better engage and guide patients to the proper level of care.
Hi, my name is Zona Liu, co-founder of Ocular Technologies. Our mission is to empower physicians to provide timely and quality eye care to every patient by leveraging telemedicine and AI. Today, we're developing a turnkey solution for emergency rooms and urgent care centers, including a portable device that records high-fidelity videos, a secure telemedical platform, and a network of eye specialists. We have started clinical studies and look forward to connecting with new partners through Mass Challenge. Thank you.
The need for remote care in the home has never been greater, and we need technology to be a conduit, not a barrier. We are OmCare, a digital health company developing a platform of products that enable remote care and promises right med, right time, right person. We're commercializing in 2021 with an expanding list of partners to bring current and new services into the home, to improve health, increase caregiver efficiency, and reduce cost. We welcome conversation. Thank you.
Hello, my name is Brent Chase, and I'm the CEO of PAL. PAL is a remote patient monitoring system that improves pediatric therapy outcomes through increased parent engagement in in-home practice. Consisting of a wearable device and software platform, PAL has shown an 80% increase in parent engagement, a 40% increase in time saving, 85% increase in patient satisfaction, and overall better therapy outcomes. So, wouldn't you want to be our PAL?
The importance of community is more apparent than ever before. We have built an empathy-driven, privacy-first community platform that helps you manage communications, share knowledge, encourage dialogue, and create mentorship and buddy programs within your community. Use cases could range from support groups for common illnesses, to internal employee networks for people of color, to resource centers for families of people with disabilities. We are looking to partner with a variety of pilot organizations so we can improve our solution even further. Thank you.
Language makes us human. How we communicate is central to our quality of life. It helps us share our needs, wants, and brings us closer to those we love. But diseases like ALS can take the ability to speak away. For people like our friend Steve, language only happens through assistive devices. Many of these are slow to use, unintuitive, or simply too expensive for many of the people who need them the most. But now there's Polly, a parrot-inspired robot that harnesses AI and machine learning to give a voice to people like Steve, faster.
Hi, my name is Tim Horan. I'm one of the co-founders of Pattern Health. Our mission is to accelerate the whole digital health innovation process. There are 3 areas of programs that we're currently working on now. One is patient monitoring, things like remote cardiac rehab, risk scoring algorithms to improve clinical decision-making, and condition-specific digital health programs for things like heart and vascular, cancer, mental health. We'd love to share more about what we're doing. Thanks.
Nearly half of 300 million annual antibiotic prescriptions in the US are unnecessary or inappropriate because the gold standard culture takes days. FAST is a health tech startup developing AI computer vision technology to fight antibiotic resistance. Our cloud-based mobile platform delivers the full continuum of care, including at home, and enables telemedicine. We're entering commercialization and looking to partner with champions to identify the most efficient pathway forward.
Hi, I'm Lonnie Starmo, CEO of Pops. I'm a 30-year Medtronic veteran and a person living with diabetes. Have you ever wondered, with all the diabetes solutions out there, why we still have so much non-compliance and cost? It's because as an industry, we keep trying to manage patients. Pops takes a different approach. Through our AI virtual coach Mina and a new glucose sensor, we give people the ability to live their life and manage their diabetes. We have multiple revenue generating contracts, but we're looking for innovative partners to help accelerate changing lives.
How you doing? Alex Westella, one of the founders here at Quicker. A couple of years ago, a neighbor of mine had a really bad episode. He ended up in the wrong facility. He was at an urgent care and he really needed to be at the ER, and he had a near-death experience. And that's what really is one of the main reasons why we started this company, because this happens too frequently here in the US and around the world.
Let me check the EMR to see how my patient's doing at home after his tonsillectomy. His parents are using the SafeDose mobile app, and it looks like no fever, good PO intake, and he's receiving all of his pain meds as scheduled. I'm so glad SafeDose Family was customized to match our hospital's post-op instructions and was also available in Spanish for this family. We should match all of our procedures in SafeDose Family.
CDC estimates 98 million US population is struggling with mental health or substance use. Sadly, 70% of those seeking care drop out of the treatment program. There is a better way for those people, and my cousin who dropped out and committed suicide. SafeSurf is a National Science Foundation-backed HIPAA-compliant digital platform that keeps members on track between visits. By combining integrated care model using AI personal health tools, we help underserved members across the country to stay in treatment while unlocking millions of dollars of reimbursements for providers.
More than 1 million men, women, and children in our country today are going to sleep tonight not knowing if they'll sleep in that same place tomorrow. Samaritan is a support platform that empowers people without a home to move forward. Human services, health systems, and health plans license the platform to provide hope to their most vulnerable populations by better connecting them into the social and financial support needed to reach housing and health goals.
I'm Suzanne Mitchell, and I'm the founder of See Yourself Health. Loneliness and isolation are fueling an epidemic of chronic stress and chronic disease. At See Yourself Health, we're bringing people together in real time in a modern, playful online world designed to build strong teams and better population health. We're doing things differently, and we're getting results. We're not another chat room. We're not another dashboard. No way. Think Zoom meets Minecraft and then dream even bigger. Come see us.
Hi, I'm Nicola, CEO of Semantic Health. We use deep learning to make unstructured and complex health data actionable. I'm a medical doctor and machine learning scientist, and it was astonishing to see the massive amounts of unstructured data we accumulate in healthcare that we just cannot use. We're initially automating medical coding and auditing, which saves hospitals millions and improves reimbursement rates. But our vision is to use this technology to create an actionable data layer that can power value-based care and precision medicine. Thank you.
At Shurpa, we're trying to solve the problem of access to care in home health. We leverage our logistics expertise and our proprietary AI to unlock hidden capacity in existing home health systems, reducing clinician hours wasted behind the windshield by over 15% and giving them more quality time with patients. Shurpa is the first enterprise SaaS platform designed to manage clinicians in the field for in-home healthcare, with compliance, visibility, and custom reporting baked into every layer.
Hi.
Everyday doctors in the intensive care unit make critical decisions, but they have very little diagnostic information. We have developed groundbreaking technology that uses data science and AI to predict disease in minutes at the point of care. Starting with premature babies, we generate information at birth so that doctors could treat early, saving lives, improving outcomes, and reducing costs. We're looking for partners in the US.
Maternal health is a $100 billion market that's been called a public health crisis. I'm Shannon Field, founder and CEO of Soci. Think so she can thrive. I'm a 20-year veteran of Silicon Valley and a mom of 3. Soci is digital health and wellness for new and expecting moms that complements the care of your physician with educational content, tools, and virtual support. We're outcomes focused and a win-win for moms and payers. We have a live product with rave reviews and a product launch coming up. Be in touch. We'd love to share more.
Hi there. My name is Nick Nomonico, and I am the CEO and co-founder of Strados Labs. As an asthma patient, I know how hard it can be to recognize my symptoms like wheezing or coughing or shortness of breath until it's too late. And that's why we created a non-invasive smart sensor-enabled platform called RESP that has been clinically validated with hundreds of patients to accurately measure wheezing and coughing, share that information back to care teams remotely in a hands-free way. Work with us today to make every breath count.
Hello, my name is Tanya Koch, and I'm the co-founder and CEO of Tellus. Tellus is the device you see on the screen. It's a hardware and software solution that understands actionable health information about a person in a room. My co-founder and I were really inspired to build a non-contact and passive device based on our own experiences using wearables and cameras for our aging grandparents, something that did not work at all. We're bringing an innovative solution to remote monitoring, something that's incredibly helpful and important in this time of COVID with remote monitoring. There are many use cases, and we look forward to hearing from you soon. Thank you so much for your time.
Hi, Mass Challenge. My name is Maria Picconi, and I'm the co-founder and CEO of a digital health analytics company called Trend Community. Here at Trend, we rapidly turn social media conversations into real-world data about patient experience. Our work has uncovered new symptoms, inspired unique study protocols, identified novel treatments, and accelerated regulatory approvals. We've earned the trust of over 60 communities, and we're looking for partners to join us in revolutionizing the world's understanding of diseases. Thank you.
Hi, I'm Eddie, the CEO of Uplift. We created Uplift because while depression and anxiety affect 1 in 4 Americans every year, only a minority get effective help. Luckily, these disorders can be tackled by using effective skills typically taught through cognitive behavioral therapy. Uplift is like the Duolingo app, but instead of learning a new language, we help patients, employees, and everyday people learn mental health skills so they can lead a happier and more fulfilling life.
Hi, my name is Janesh Patel, CEO and co-founder of Uptime Health. We work with healthcare facilities to use their own data to predict future medical device, repair, and replacement events. We can help healthcare systems save millions of dollars on unnecessary spend, as well as help inform their departmental budgets. As part of our program, we also provide a digitization of several paper-based quality control processes for medical devices. Working with us, you'll save cost, as well as limiting the operational disruptions caused by faulty medical devices.
My name is Keith Kirkland, and I'm a co-founder at WearWorks, where we build products and experiences that communicate information through touch. Our first product, Wayband, is a wristband that gently guides users to an end destination using only vibrating cues. And in 2017, it helped the first person who was blind run in the New York City Marathon without sighted assistance. We're deeply excited about working with partners in the visually impaired and low vision spaces, and we're also excited about working around mobility-assisted technology and the aging communities. Thank you so much.
Hello, my name is Dr. Zachary Hermes, and I'm the co-founder of Wealthy, where we are working to help children thrive in health and wellness. At Wealthy, we see crisis as a catalyst. COVID-19 has thrust health inequities to the forefront and challenged K-12 schools to critically consider the ways they serve children beyond instruction. Our digital health platform is equipping school partners with data-driven insights. We provide digital tools to assess student health needs and analytics to identify health trends in school communities.
I'm Craig Lamoli, founder and CEO of WellSheet, a predictive clinical workflow platform that radically improves physician efficiency. We have distribution partnerships with Epic and Cerner, and we've deployed to some of their largest clients, like RWJBarnabas Health, where we were able to reduce physicians' time in the EHR by over 40%. We've raised about $6.5 million to date, and our existing clients include over 40 hospitals.
Did you know that a wealthy Black woman with no diabetes is 3 to 4 times likely to die from pregnancy-related complication compared to a white woman who is poor and have diabetes? Women of color are often ignored, judged during their pregnancy journey. At WellMe, we've created a platform to help women own their pregnancy by connecting them to peers, health experts, and screening to navigate the health system for better outcomes. Join us because the future of healthcare is patient-driven.
Falling down. It's the #1 reason for trauma death. 1 in 4 older adults fall down every year, leading to $50 billion in medical costs. The Zebrio Smart Scale measures weight, balance, and fall risk. It can predict who's going to fall down in the next 12 months. With Zebrio use, we had a 54% reduction in falls. So empower your older adults for better outcomes in the clinic, community, and at home. I'm Dr. Catherine Forth, the CEO of Zebrio.